by the way of introduction, my name is Shan. We've interacted physically and telephonically with quite a lot of you guys here. And I would like to welcome you on board and thank you very much for taking your time from your busy schedules to join us today to discuss this very important topic. A couple of months ago, quite a number of our membership did contact us, and they wanted to see if we could some health protection or some fund, at least to provide some health services to parents who are based in Zimbabwe. The majority of the people contacted us from diaspora. And that got us thinking, deliberate, until we decided to get everything licensed. So we have been getting licensed by the Health Professionals Association in Zimbabwe, by the Harare City Council in Zimbabwe. And after we got our licensing, then we needed to have all our multidisciplinary teams licensed as well. That's all our healthcare professionals licensed. I need to start talking about the health fund, the dynamics that Prasanna was for the past 2-3 years, health-wise, that the COVID. That is quite affected in terms of healthcare. And we found quite we needed to set up we need to come up with a strategy that the relatives that are abroad, the relatives that are here but have other jobs to attend to and can't be parents 24/7. We decided to then set up an ABWA health fund. That's going to be discussed in detail later on by Mr. Douglas Runanga. However, the reason why we needed a health fund was for convenience purposes, like I've said. We have quite a membership that are based in diaspora, and they have their elderly parents here in Zimbabwe. They cannot attend our healthcare facilities, are completely overwhelmed. And again, the reason that healthcare facility that's straightforward. So we needed to set up some sort of an action plan to make sure that people are looked after, or people can access healthcare wherever they are, be it home or hospital. So convenience was one of the major drivers for us to set up the health fund. It also, for us, it was some form of contingency planning, because we did not know how far the COVID or the corona pandemic was going to take us. It's still with us 2-3 years down the line. We do apologize for the disruption. We have network issues, and our IT are trying to work on alternatives at the moment. So bear with us. I'm back on. I was just explaining that we did set up the health fund, and one of the reasons was the convenience part of things, and then we needed to also make sure that it was part of the contingency planning. And lastly, the health fund was some form of risk mitigation. I was explaining that emergencies do happen in the most inopportune time, most of the times when we are the least prepared, don't have money, we're traveling. So by having this buffer, the cushion, that is the health fund, should anything happen anytime, we are ready. The second thing we are going to talk about is the home care side of. Matron is going to expand on that, mainly because but again, the home care being the most convenient health service at the moment, the other reasons that I've mentioned earlier, it also is proven that it gives some form of independence to the patient. It's the safest at the moment, considering that the hospital has become the breeding ground, the breeding ground for most of these infections. It has always been a breeding ground, but with the COVID-19, it has just exacerbated the already complicated situation. The other beauty of home care is the personalized care. So there's going to be a one-to-one care between the nurses, the doctors. The patient who is at home will receive the full care or full attention, undivided attention, whereas in the hospital, I'm sure you're fully aware there are some ratios, the healthcare professional ratio versus the patients that one can look after in a day. So considering that, we decided, okay, home care is probably the safest at the moment. We do have a team of professionals. We're talking trained nurses, trained and licensed nurses, doctors, physiotherapists that are part of this multidisciplinary team to attend to the patients at home. And most importantly, when especially the elderly are not feeling well, they would rather be at home. And this kind of setup allows for the relatives, the other loved ones to visit them, giving them companionship that they have the time really need when they're in this particular situation, rather than being in a hospital setup where, especially nowadays, the visitation is limited to either one or two persons. And the other thing that we're going to discuss is the primary health care. So we decided, of course, when we're doing the home care, one of the things that we're going to cement is the wellness, the health education side. And I'm not going to get into that because this is just the introduction. The wellness part of things and the health education. But should everything else fail, we did set up a primary healthcare center, which is a clinic that's based here in Mount Pleasant, where we're calling you from, the same address, 119 Pendennis. So again, Matron is going to expand on this, how a patient can be brought from home to the clinic. We do the observation at the clinic, where we're providing quite a number of services. We only refer for hospitalization should anything else fail. So the primary health care is going to be discussed at length. The last, probably most equally important thing is the investment side of things. Again, I'm going to talk about the investment probably last, because I'm going to hand over to Matron at the moment, because she needs to discuss the home care in detail with you. Thank you, Matron.
I'm Matron Kashinga, and I'm going to be presenting the services that we are offering at ABWA Health Clinic. Our main thrust at ABWA Health is into home care nursing. We are providing care to patients in the comfort of their homes. And we are working with the professional and qualified team of doctors, registered general nurses, and we've got healthcare assistants. And we work as a multidisciplinary team where we have the physiotherapist, the psychologist, and many other medical professionals that we work with, so that the patient receives the total patient care that they need. So in home care nursing, the patient can receive all the services that are offered at any clinic or any primary health care center or any hospital. For example, we have doctor's consultations where the doctor visits the patient. We do a vulnerability assessment to assess the patient's environment and the patient's needs. And then we come up with a treatment plan that is designed to the patient's need. And all the team members that are required for the patient wellness are engaged so that the patient receives the total patient care that they need. So basically what we do is doctors do the consultations, and they come up with a nursing care plan together with the nurses, and the activities that are offered to patients, they vary according to the patient. We offer activities such as total patient care, which includes the simplest things like bed baths, oral care, TENS, the basics that the patient needs. And also, after the doctor consult, they come up with a treatment plan, and the nurses, they give the injections, they give the intravenous fluids, they do all the orders that the doctors have ordered. We also have diagnostics, like we have the ECG machines, the ultrasound scan machines that we are using for any diagnostics for the patients. And we are also working with other referral radiology imaging departments for the services that we are not offering in-house. We are offering them, we outsource them. And we also have laboratories that we are working with, like Lancet, Diagnopath, and many others, where patients can have their blood samples sent to and have their results within the same day, within minimum hours or specified time. Our services can be even a few hours, from as little as less than 6 hours, 12 hourly or 24 hourly. And we also offer counseling and health education to our patients concerning any medical issues that they have. And sometimes we refer to psychologists for issues that would refer specialist attention. We have flyers, we have pamphlets and posters that also help in the health education. And we also have the physiotherapy department at ABWA Clinic, where we have a trained and experienced physiotherapist and a rehabilitation technician. They also go, like Melissa is going to elaborate on that, but they also come to your homes and attend to the patients. And if they require to be transferred to the clinic for further management, we have an ambulance that can transport patients from home to the clinic for further management, be it observation, be it physiotherapy, or we can also transfer patients to other specialist centers like the dialysis center, where they get their further management. We are all linked to those centers. And we also offer family planning services. We have Jadel insertion and removal, we have loop insertion and removal, and we have implanon insertion and removal, and we've got contraceptive pills, we have Depo Provera, and the intrauterine device. We also have small tests that we do at the clinic or in the homes, like the rapid COVID-19 testing, the rapid malaria parasite screen, RBS, which is checking sugar, HIV testing, and just to mention a few. We also do PCR, which we send to the labs, like I mentioned before, for further testing. We also have mother and baby wellness clinic, where we do the monthly weighing of patients, of babies. And we are working on a plan to vaccinate and immunize the children, and also to do antenatal and postnatal care for the mothers, but it's still work in progress. We have the ABWA Health Fund, which Shamiso talked about, but other patients also might be on other medical health, medical aids. We accept accept them, like First Mutual, Genfin, Fidelity Life, Peacemas, Cellmate, Generation, Masca, Advantage, Bonvi, and Minerva. You are not excluded as part of our patients that we can attend to. We also offer respite services. For example, when a family member needs to be relieved of taking care of their relative, we can send a nurse just to look after the relative for them so that they may take rest and refresh and then come back to continue with taking care of the patient. And we also escort patients for various procedures. I will leave Melissa to talk more on physiotherapy, which is one of the services that we are offering at ABWA Health Clinic. She will elaborate on that. Over to you, Melissa.
Good day. My name is Melissa and I'm a physiotherapist at ABWA Health. So I'm going to be talking about physiotherapy and the services that we offer at ABWA. So ABWA physiotherapy is all about adding life to years. This means that we habilitate and rehabilitate our patients to the highest level of function so that they can live a positive quality of life. So our department caters for both pediatric and adult patients, whether they are inpatients, patients in other hospitals, or outpatients, patients coming from home, or those that would love to be seen in the comfort of their homes. So for pediatric patients, we'll be seeing patients with clubfoot, spinal bifida, cerebral palsy, Down syndrome, and many other conditions. So with these pediatric patients, we'll be trying to see that they can actually function to the highest level, so that they can lead an independent life. For adult conditions, we'll be seeing patients with stroke, with fractures, arthritis, back pain, spinal cord, just to mention a few. So we have many treatment options at ABWA Health. These include hydrotherapy, which is actually one of the most effective ways when we are trying to habilitate our patient. So generally, we'll be trying to use the special properties of water so that we help our patients to habilitate. We'll also be making use of electrotherapy, where we use machines to help stimulate our patients' muscles so that they can come to full function. Manual therapy can also be used, which will just help our patients to get better by bringing back the muscles where they are supposed to be and the bones, and also trying to manipulate the whole body so that it becomes in sync. We'll also use exercise therapy. We'll also use exercise therapy, where we'll prescribe exercises for our patients so that they can become fully functional. So in conclusion, at ABWA Physiotherapy, we'll be using a holistic approach to treat our clients for an effective and efficient result. Thank you.
Good afternoon. This is Kundai Mahachi from IT. Now we're moving on to Douglas. We'll be taking you from here. We'll be continuing with the presentation. Over to you, Douglas.
Greetings to all those that are joining us online to this presentation. My name is Douglas Runganga. I'm on the underwriting side. So I'll straight go into the presentation. Kundai, if you could share the slide, put the slide on for me, please. Okay, I'll proceed. So we're here to talk with all those online about the ABWA Health Fund, its structure and its service coverage. So basically, the ABWA Health Fund is a creation in response to members' call for a solution to their healthcare needs. And as a result, ABWA as an association is decided, okay, I've been asked to put on that. Okay, thank you. So I was saying ABWA, in response to its members' needs, they've decided to create a fund that can assist members in terms of access to healthcare services. Mostly what happens is medical needs come as an emergency, and half the time people are not prepared for such emergencies. And as a result, we end up with complications because people can't fund their healthcare needs. Right, so in the Zimbabwean scenario, some of the challenges that are faced are basically the high medical costs that we experience. We also have issues to do with access services where most people try and get service from government facilities, but we all know what is the problem with this. We also have got an issue of poor care outcomes. This is the reason why the ABWA Health Clinic and the home care service is there for the members to ensure that members are actually paying for outcomes, not just to pay for probabilities of success in terms of patient care. We also have got issues of unpreparedness on the part of the member, especially in terms of ad hoc medical needs, where somebody gets sick or gets a medical condition and you're not financially prepared for it. So, solution to all those challenges is the ABWA Health Solution. We have got a high quality clinic with full complement of doctors and nurses, as alluded by Sister Kashinga. And these services are available on a 24-hour basis. Home care by both nurses and doctors. ABWA Health manages your health care across all your needs 24/7. And we also facilitate access to electronic medical records to ensure that members are able to view their medical records wherever they are. Then in order to help members with budgeting and minimize out-of-pocket expenses, ABWA Health have partnered with Advantage Health on the underwriting side to ensure that we set up an ABWA Health Fund whose purpose is to create a ready medical expense fund for the ABWA members as and when the need arises. Members pay a set subscription on a monthly basis, and from this, they're able to access medical services as and when they require. And each member will receive an ABWA Health Fund card for use in accessing services as and when the need arises. In terms of our service coverage, the fund will provide primary care, as mentioned by Dr. Shami, access to medical services from the ABWA clinic, home visits by ABWA medical team, access to selected primary care facilities and doctors in locations without an ABWA clinic, because we've got an extensive network of providers that exist. I saw one of the members was asking about Matebele and rural and Matebele and villages. We have to make sure that we create that access for the members from wherever they are, for those that are not within the vicinity or access of Harare. Where necessary and where ABWA clinic can deal with cases, specialist care on referral from the primary care line is available. Diagnostic services such as lab and radiology, as alluded by Sister, is also funded from the fund. Private hospital admissions, where this is required, is available. Emergency ambulance services is also available for members. We will also place a greater emphasis on the wellness of our members. Shami already spoke about that, but we want to make sure that our members are taken care of their lives in a 360-degree manner with chronic condition management programs, including monitoring and treatment. We also want to look at issues to do with treatment adherence for chronic patients, and also including drug disbursements. And we also look at lifestyle coaching. Many people focus on treatment alone without issues to do with lifestyle management. So the ABWA Health Fund, in conjunction with ABWA Health Clinic, will ensure that our members are exposed to lifestyle management. Okay, I'm going to skip the slide on investment and the benefits. Pride will talk about that one. Let's move on to slide number 25. Okay, so having said that, what are we saying to ABWA members, the call to action? You are able to download our application forms, complete these either in person or online, and our acceptance pack will be emailed back to you in 24 hours. And once approved, payment is made through the provided bank details. Our IT are going to guide our members further on how they can access the online application. But for those who can't, we are still available via email, via telephones, to assist members who want further information and who want to process their membership applications. Next slide. Okay, so because this is a membership-based scheme that we are doing, obviously some people are going to be asking about waiting periods to say, if I join, at what stage do they start benefiting? So what we have done is the first point of care is our primary care through ABWA Clinic. And because we want to build capacity for the fund, we are going to give a 3-month waiting period for people to be able to access primary care through the ABWA Clinic. All right, then we have 6 months waiting period for pre-existing chronic care, 6 months for specialist care, and 6 months for hospitalization, 9 months for maternity, and 12 months for those on chemotherapy. Waiver of waiting period can be considered for members who are transferring from another local medical aid fund, but these will be processed on a case-by-case basis upon application. Right, so that brings us to the end of the presentation on the health fund. I'm sure at the end of the presentation, there will be some questions. I see some are coming online. We'll try and respond to those once question time has come through. Thank you very much for listening.
Thank you, Douglas. I hope I'm audible enough as it is. My name is Pride, and I'm the finance officer for ABWA. I just want to do a quick rundown of the financial implications of the fund that we are referring to, the fund that we are launching. In order to access these benefits, this is the basic rundown of the, I'm sure this answers Rua's question, who is asking how much is the monthly fee? And also, is there a cap to the number of times one can access the service? I'll try to answer both of them if they're not on the figures. So the basic package is $50. This is US dollars before anyone asks. When we say basic package, we are saying this is for a member who is going to be joining, and they'll be enjoying the benefits of the fund or the medical aid services without any, what I would like to refer to as special circumstances. This is in order to cushion the fund against certain circumstances. We'll be charging a basic package. We have a basic package for adults, which is $50. And for children, it's $25. By children, we are referring to those who are below the age of 18. So if you have your child who is above 18, but who you still consider to be a child, for the purposes of this fund, we will be considering them as an adult. Naturally, we have special circumstances, especially relating to age, because we are trying not to exclude anyone on the basis of age. And because of that, we are also not blind to the health implication of advancement in age. So for members who will be joining after they turn 60, there will be an extra $10 on the basic package. So basically, if you're 60 and above, your contribution will be $60 per month. Okay, I'm trying to answer these questions as I go. So if there can be a bit of clarity on the questions, because I'm seeing a question saying, is there anything for the investors in the presentation? I'm not sure. Okay. At the end of the presentation, we are going to have something. So I was saying, if you are above 60, that has added implications on your health needs, and we are trying to be in a position to cover those as well, so that we don't exclude you from benefiting the. I'm hearing that sound is lost. On my end, it seems okay, so maybe I just need to be a bit more audible. So yes, that's that. For those who are 60 and above, it's $60. And then for chronic patients, this one is a bit complicated, and you find that on some instances we'll be dealing with chronic cases on a case-to-case basis, because our onboarding process will require us to know whether or not you have any chronic ailments. But the basically, what we can say, what I'm saying is, if there are any chronic implications, then there will be an added $20 to your package. So what this means is, if you are going to take someone such as myself, I am not 60 years old, I'll be paying $50 for this fund. But if I happen to want to co-opt maybe my grandfather or my great uncle who's 65, it will now be $60 for him. And if he happens to have a chronic disease which requires chronic management, chronic medical management, then his membership or subscription goes up to $80. In terms of children, anyone below the age of 18, the basic package is $25. Naturally, there's nothing there which applies to those over 60, because we are talking of people under the age of 18. Then for children with chronic illnesses, there's an extra $10 charge on the subscription. So if your child already has a chronic illness, or if your child requires chronic management at some point, then it goes up to $35. That's the cover if you want chronic management included in your services. Now, what that means is, naturally, there are ceilings in as far as how much benefit one can draw from the fund. for one reason, to keep the fund viable and to deter abuse of the fund, we have limits. The global annual limit for an adult is $8,000. What does that mean? It means in the space of 1 year, in the space of 1 calendar year, if you are a member, your waiting period is lapsed and you are now able to draw benefits from the fund, you can draw benefits to the tune of $8,000 per year. So basically, it means that if you're going to get primary health care, visit your physician, visit your specialist, and what have you. If you are going to get dental treatment, if you're going to get optical treatment, whatever it is that you're going to be treated for or be consulted for, the fund will pay up to a limit of $8,000 a year. I'm seeing a question from Francina here. Is medication and prescriptions included in the packages? Yes, it is. So basically what it means is your medication, you can divide 8,000 by 12. You can see your monthly limit in as much as how much you can get if you're going to be getting maybe a monthly filling of medication. But basically, if you are going to be getting treatment, it will be up to the tune of $8,000. The inpatient limit, that's $4,800. It means this is what we can pay for you to be admitted in a hospital. So if you're going to be maybe involved in an ailment which requires you to be admitted in a hospital, the fund will pay up to $4,800 a year. And then the outpatient limit, this is where you're just visiting the doctor, getting a prescription, and then you go back home. That the limit is $3,200 for the outpatients. What it means is, with these limits, this is basically what we are willing to, what we are able to provide in as far as medical cover. We, again, this is in US dollars, and these benefits are for each beneficiary. So if you join as a member, and then you're also paying for your child, it means each one of you will have this limit. This is not a limit which will be applying to the both of you simultaneously, but this is a limit which will be applying individually to every registered member or every registered beneficiary. Is carried included? All medical emergencies are included. And for these emergencies, on a case-by-case basis, the waiting period could be waived. But this is strictly on a case-by-case basis after we evaluate the situation to see that it warrants the waiver of the waiting period. Maybe just to preempt a bit, there will be additional charges and packages that we are still working on because we just want to iron out the actuarial kinks. But for the basic packages, this is what we have. 60 and above, we all know. Yes, at 60 and above, we all know members most likely are prone to chronic conditions. They have 60 plus 20, or it's catered for in the 60s. So basically, the chronic condition cover, you can opt not to have it, and you can just opt to have a medical cover for non-chronic conditions, even if you've turned 60 years and you're 60 and above. That's where you pay the be $60. But then if you want to be covered for chronic conditions, regardless of age, whether or not you are below or above the age of 60, there's a $20 charge for you to be part of that chronic condition cover. I hope I've answered you. Let me just try to see if there are any questions I missed. But I think Shami did answer most of them. Do you provide? Yes, we do. So yes, in terms of the financial implications, this is what we are looking at. Considering that the majority are actually members of ABWA, existing members, we are open to having arrangements where the subs been using to send them. We are open to you sending in the subscriptions at those same channels. But as we go, we'll be opening up. We are in the process of opening up dedicated channels for the funds which members will be using. So in terms of the financial implications, I think that's it. Try so prescriptions will become part of the patient or outpatient limit, or is it irrelevant provided one does not exceed? This depends on the case. If you are admitted in a hospital and the prescriptions that depends on what you are getting a prescription for. I'm not sure if there are any other questions, but yeah, I think later on we can open the floor to questions. Thank you.
Thank you very much, Pride, for that. This is Kundai speaking. So there's an application form if you are to apply for ABWA Health Fund that we have put up on our website. And also on that, I'll explain and walk you through how you can apply on our website. Also, there's a chat box that is open to everyone, given you find yourself having challenges applying. We have a board for that. So allow me to share with you this video. So on our website, you can visit ABWA Health, the link, which will take you to this page. And there on that page is Join ABWA Health Fund, a link which will direct you to our page, our fill-in page. So this is our individual membership application form. You're going to be filling in your details in. So for the sake of our time, I'd already made a chart on that. So once you are done, there is a button to submit at the bottom of the sheet, which will allow you to send data. Once that is done, you will receive a notification that you have submitted and your submission has been successful. So once that is done, then you are good to go. Our team, the ABWA team, will receive your details and register you on our system. So at the right bottom of the page, if you can see it, chat with us. That's our platform, which we can assist you given you are having challenges on our website. You are able to ask questions and have them responded to you as soon as possible.
There is no place like home. At ABWA Health, We bring home care health services to your doorstep because your health is our priority. Let our medical family provide you with quality home-based care, whatever your health and medical needs, conveniently guaranteeing care and support 24/7. Home diagnostics, portable x-rays, ultrasound scan, ECGs. We are here to serve you. Your medical records are accessible electronically, online, anywhere. Download membership application forms and sign up now. Visit the clinic or call for more details. ABWA Health. Convenient home care services with a difference.
Right. We're heading towards the end of our presentation. So generally, we're going to give you the floor to ask as many questions as you like. But for now, I'm going to talk about the investment side of things. So we've been talking about the membership. Clearly, some people would like to know how to pay for this. Those that already have access to us, they know how they can do this. Those that are in Zimbabwe, you can do through Nostro accounts, CAPS. We will provide you with the information. It will also be on the website. And those that are in South Africa can do via FNB. There's ABWA Health Fund account with FNB. Again, we'll be sharing that with you. Walk-ins are welcome as well. Those that are in the UK, you guys know, UK, Canada, you guys know how to get hold of us. And we just use similar methods. What you need to do is to register online first. But if you can't, if you're failing to do that, please do let us know so that we can help you with your registration. I'm going to touch briefly on investments. There are 2 or 3 areas where the investment is going to come in. So there's the hospital setup. So there's need to set up a whole hospital. We are operating a primary health care, which is a clinic. We need to set up a hospital. The hospital will be catering for the diagnostic side of things, and the diagnostic is subdivided into 2. So there's your laboratory that deals with all sorts of tests, be it histology, hematology, all sorts of tests. That's what we're not sure about DNA yet, but I guess Mr. Mugabe is taking care of that. So not to reinvent the wheel, we will leave that to him. We will concentrate on the lab side of things. And then there's the imaging. With imaging already, we're looking into, we're already doing the portable ECGs, come to your place, do the ECGs. Can you guys hear me? It's saying connection unstable. Please confirm if you can hear me. Can someone confirm? Yes, all right, thank you, Fran. Sure. So we're doing the portable imaging. That's the ultrasound scans, the portable x-rays to your places, like in the comfort of your house. Although we also do these services at the clinic. The ECGs can be done at your place too. We can do heart monitoring at your place. So that's as far as imaging is concerned. However, where we need to do like intense imaging, like your MRIs, these ones we are outsourcing. But in terms of investment, we're looking into setting up the whole imaging center because we want up where we have the diagnostics, that's your laboratory, that's your imaging, from the simplest thing like your x-ray all the way to the MRI. We're going to be doing that at the hospital. So the hospital would need equipment. So be it diagnostic equipment, imaging equipment, the simple things like hospital beds, although the clinic, we do have those beds, but we're talking the specialized beds like your orthopedic beds. And then lastly, we want, one of the major problems in Zimbabwe is to have a referral center where they do dialysis. So most of our patients are either flown out of the country, which has been hindered by the COVID. And we do not have sufficient dialysis machines in the country. And those that are available are very, what's the word? They're very selective in nature, discriminative rather. They're very discriminative in nature because you do need to have to go through some tests. If you have a chronic contaminable disease, your HIV and things like hepatitis, they don't consider you, they don't prioritize you. So you're put at the back burner while they're concentrating on the chronic acute dialysis cases, or what they call clean dialysis cases. So we're at the moment finalizing the price in particular. Again, whether we're going to start up with 20 beds for dialysis, looking into just laboratory investment or diagnostics investments, dialysis investments, the hospital in particular. But most importantly, whatever we're doing as far as health is concerned, I realize, I think it's Annie from Australia, she's asked a question on the rural community. Yes, we've considered that too. And that's going to be taken care of under, yes, there's going to be a figure on that, but also the charity side of things will kick in. And again, there's not going to be any limit to what sort of healthcare they can access. So that's in short on the investment side of things. So again, just to recap, there's the hospital setup that needs to be done. There's the equipment, the hospital equipment that needs to be built, and this will cover the laboratory, the diagnostics, which is our lab, and our imaging that covers the MRI scans. For those that know, MRI scans are quite pricey. The ones that we have right now can function at a clinic level. They're portables as well. But we need a center where when we're looking after a patient and we realize, okay, the patient isn't quite improving, we have our own transportation at the moment. So they'll pick up these patients, bring them to our center, do the diagnostics there. If you feel like we need to admit the patient, we admit the patient. So the whole expansion process is not to then refer the patient anywhere else. We will have the specialist services right at our center. So that's what we are finalizing at the moment, basically. So the investment figures will come to you before 2 weeks. Just get ready. It's not scary figures at all, but we just wanted to highlight to you what it is that that you're going to be investing in. Just again to recap on simpler things that we were discussing, that if you have a patient, if you have a father, a mother with a chronic condition at home, most of our parents that are at home are not as compliant. I should know because I've got parents that act like kids. They're on certain medications, and sometimes I go there. My father has completed the 1 month supply in like 17 days because so they just gave them the medical health education. And also, even if they are not reported to be suffering from anything, but because they're part of our members, our multidisciplinary team can visit them once in a month to make sure that their prescription are replaced? Is there anything that we need to do for them? If we're not quite sure, if we think things are not as we would have imagined, then we will bring the ambulance, pick them up, bring them to the clinic, if it means just observing them for like a day or two before we discharge them back home. But all this is within our care. So like I said, it's a one-stop shop with an extension on the investment side of things. So I guess now we could open up for questions. I think you guys, if you could unmute, well, I think they will raise their hands. Anyone with a question, kindly just raise your hand and IT will have you attended to. Sorry, just a quick one. I've got Mr. Gumbo here, where Mitch, right here. Someone asked the person on whether you guys are recruiting.
Good afternoon. Currently, our recruitment is on a freeze, but we are welcoming all CVs because we are creating a database of all qualified medical personnel. And as and when the need arises, we will always contact them. We'll always contact them. And then the other thing about the staff privacy, confidentiality form that bars them from sharing confidential information with third parties. So anyone who breaches that will obviously face stiff disciplinary action. And so far it's good.
Yeah. And Kundai, someone asked on the privacy, online privacy, like, yeah. Yes, the answer is yes. Your records on online are secure because only you will have a password to access your records. So not every Jack and Jill can have access to your medical records. I think it's question time. JJ is asking if there's an approximation that we could give. Not at the moment, JJ. Like I said, we do not have a couple of equipment pricing yet, so that would be premature for us to preempt any kind of amount that's needed at the moment. But like I said, within 2 weeks, you should have received that together with the return on investment and how the whole thing can pan out, or the implementation of that whole process. Where can we send our CVs? You need to write to HR. Kunda, if you don't mind typing that for us. You did, okay. I'm told Pride has already done that. Diana? Emmanuel, yes, it includes dentistry. A family package is going to be sent to you by Pride. While we're at it, there's something that I didn't hear. I'm not sure whether Douglas has mentioned it. The, what are you calling it? The tourism, what you call it? What is it called?
Right. That's the one I was saying. Still working on the actual workings so that we have specific figures of how much we'll be charging, what the benefit.
That's called the tourism package. What do you call it?
The
travel coverage. All right. Okay. For our members, again, that's something that that's probably very important to mention. We did have one of our members that fell sick in Dubai, and she landed at Harare Airport. Again, she was still not feeling well. One of our services is, if we're alerted, we will have someone, an ambulance service, waiting for you at the airport, pick you up, bring you to the clinic before you even go home, get all the necessary tests done or baseline observations to check on your condition before we can release you home. Should any member visit Zimbabwe and something happens to you, again, you have access to us on condition that they're emergencies. That's what we're covering at the moment. We only cover emergencies to our members. But again, we will pick you up, bring you to the clinic, do whatever that needs to be done, or attend to you at home. Should there be any need for you to be admitted, then each case is going to be treated accordingly. But that's one of the advantages of being a member.
Since mobile data is turned off, you'll have to turn on Wi-Fi and connect to a network first.
Can anyone outside Harare have access to treatment? Sure, like I've said, we're covering the whole of Zimbabwe. We do have transportation, transport to transport our healthcare professionals outside Harare. I guess, when was it recently you heard that Marandera case? Yeah, so we can go anywhere in Zimbabwe. However, again, since this is the launch, we already have started the preliminary registrations in Bulawayo, followed by Mutare, hopefully. So yeah, but like I'm saying, right now, we can access you wherever you are, provided there's a road. How long is the waiting period for optometry? Eyes? 6 months. 6 months. When do our subscriptions commence? We are ready for you. You can start yesterday. How many times can one access the health service per year? So there's that global limit that you've been given, and in inpatient and outpatient fees, it really would be very prudent for you to be savvy about your limits, because if you then utilize all of them in a month, like if you utilize $8,000 in a month, it means you've covered your whole year. Again, for those that are willing to cover the whole year all at once, there's a discount on that. Douglas, correct me if I'm wrong, but my understanding was you then have to just subscribe for 11 months, not 12 months. That's my understanding. Do investors also get free healthcare? It's not free healthcare as such, because what we're saying is, if you decide, if you're in Zimbabwe and you join the health fund, the finance are ready to go through the whole process with you. If you are in diaspora and decide to visit Zimbabwe, and so there's a separate package to that. But all the services that are rendered to anyone who is on healthcare, they're extended to you too, as the investor. But I'm saying, as an extra, should you feel unwell on your way to Zimbabwe and you get to the airport and we're alerted, we will come pick you up and take care of you. While you're here, all emergencies, again, will take care of you. So that's one of the advantages of being a member. Okay, a good question. I'm not sure who EC is. They're saying, so those who come from abroad with travel insurance that covers medical, will you take? I would like Douglas or Pride to answer that, but my understanding is, in order for, you've seen all the other medical aids that we've highlighted, and our underwriters advantage. And I guess there's going to be a need for a special MOU with the outside medical aids in order for us to then get reimbursed should you utilize your medical aid while you're in Zimbabwe. Douglas, if you can hear me, can you please answer that question? They want to know if they could utilize their travel insurance from wherever they're coming from. Patricia, does the $50 cover diagnostics? Yes, it does. Laurie, what are the costs to pay yearly? Those have been discussed as $50 monthly. And should you decide to pay all at once, then minus 1 month worth. So $550 basically per year. Miss Lee, yes, IT are going to put a question answer document on the website for prospective members, like you've suggested. Any other questions?
Will you be doing another session for investors?
Yes, there's gonna be another session for investors because that's when we're going to be talking about how much to be invested, where to be invested, and what's your return on investment on there. Like I said, we've been let down. We hoped by now we would have all the figures ready, and then we would just discuss them with you and calculate the return on investment. But again, I hope we will have everything ready in less than 2 weeks, in a little less than 2 weeks, yes. Can you share website? Can someone type the website? It's www.ABWA Inc., which is African Business Women Association Incorporated.com. Laurie, yes, it does. Does this cover all illnesses? Yes, it does. But again, we will share the information after this because there are certain illnesses like chronic illnesses that that have a kick-in period, what do you call it? The coverage period that starts from 6 months, and there are some illnesses that start coverage within 3 months. So that's going to be posted. It's been discussed as well. Will there be satellite clinic in Matabeleland? Yes, we have just mentioned that we're going to set up, we are in the process of setting up in Bulawayo. We needed all the licensing from Harare to be ready. And now that they're here, we start engaging with Bulawayo Council. So chances are we're going to have the satellite clinic in, which one is the Bulawayo capital? In Bulawayo.
Yes.
All right. Okay.
Bulawayo is province.
Okay. Musa, are you hiring nurse aides and caregivers? So again, probably by next week or so, we will be contacting you. Once we've sorted out the clinic over there, we'll be contacting you because we'll then these guys, these nurses, nurse aides would need to then submit. They could submit their CVs here, but again, they would need to be interviewed in Bulawayo. So like I said, we're in the process of doing this. Once we are ready, once the licenses and everything else is ready, we will contact you and oblige. Any other questions or additions from the team? Douglas, do you want to add? Okay. If we don't have further questions, I guess we're gonna adjourn, and you were free to write to us. Matron, do you mind sharing? Of course, the team can be accessed at ABWA. We need the landline. Those that are willing to visit us, if you just Google African Business Women Association, you get a Google map on there showing you our physical address where we can be found. These services are available 24/7. The clinic services, by the way, we're talking about the investment services. The clinic services you can access 24/7. Yes, are you providing mental health services? Yes, we are. Most of this information will be on our website. The presentation, after some editing, will be found on the website, again, under ABWA Health. The presentation will be there should you want to share with other people. And the figures, feel free to write to finance. For further explanations, feel free to contact us on ABWA Health. And I'm going to share Matron's number with you. Can you Matron's number? So it's +263 772 743 411, but it's going to be put on the screen. Okay, if there are no additions, suggestions, anything. Thank you all for joining us, and happy Friday.